Hi everyone, in this video we will be discussing about the MECKEL'S diverticulum. It is also called the ileal diverticulum because it occurs in most of the cases near the ileum region of small intestine. Before going to know about the MECKEL'S diverticulum, we should know what the vitellointestinal duct is. During the intrauterine life, the yolk sac and the midgut are connected by a tube called the vitellointestinal duct. It is also called the omphallomesenteric duct. Generally, this vitellointestinal duct disappears at the end of 4th week of intrauterine life. But in about 2% of the people, it fails to regress completely and the proximal part of it remains intact. This persisted proximal part of the vitellointestinal duct is called the MECKEL'S diverticulum. It is considered as a true diverticulum because it contains all the layers that are present in the gut wall. Now coming to the features of it, there is a rule called rule of 2 to remember its features. It is 2 inch in length and 2 feet proximal to the ileocecal wall, occur in about 2% of the people, 2 times more common in men, and 2 types of ectopic tissues may be present like pancreatic tissue or the gastric tissue. Normally it is symptomless or asymptomatic, but it may also cause some clinical problems, like in some people it causes the intestinal obstruction. Due to the presence of gastric mucosa or the pancreatic tissue, their secretions causes ulcers in that region. When the MECKEL'S diverticulum is inflamed, symptoms will be similar to the acute appendicitis. For example, in a clinically diagnosed condition of acute appendicitis, if a healthy appendix is found during the operation, then the surgeon should look for the MECKEL'S diverticulum since the symptoms are same for both of them.